Hello, doctors. Nice to meet you. My name is Yong-Seok Jo. I will start Sinus-born augmentation course. I graduated dental school 1989 and I trained oral and maxillofacial surgery. Now I'm work as a lecturer of dental bin. Let me introduce maxillary posterior site. The maxilla is 3.5 times more edentulous than mandible, and occlusal force is 3 times great in posterior. Maxillary sinus continues pneumatization throughout life, and the maxillary bone density is not good. Usually they are very soft. So treating edentulism in the posterior maxilla is a challenging clinical entity. If this patient wants implant, what is your treatment plan? If you can do sinus-borne augmentation, this will be your patient. However, if you cannot do sinus-borne augmentation, you may refer or give up this patient. How many experience do you have on sinus-borne augmentation? Someone have no experience. Someone may have crestal approach sinus-borne augmentation, and some already experienced lateral window approach sinus-borne augmentation. My lecture will be helpful to everybody, independent of your experience. This is my objectives of SBA surgery course: to get clear concepts of sinus-borne augmentation, to make a proper diagnosis and establish solid treatment plan, to learn the most fine surgical technique for sinus-borne augmentation step by step, to understand and manage possible complications during and after sinus surgery, to challenge and begin performing sinus surgery on your own. My sinus surgery lecture is characterized like this. The lecture is based on the experience of more than 3,700 sinus-borne augmentation surgeries over 18 years. Essential knowledge for sinus surgery is taught. Practical knowledge and skills instead of knowledge based on theory is taught so that immediate application in clinic is possible. Adequate clinical cases are presented for better explanation, and numerous videos are included for better comprehension. This is online lecture, so there is some limitation. In offline course, hands-on using excellent training supplement is provided, and opportunity to perform on live surgery is provided. We are planning offline course in the future. Okay? At that time, please attend the offline course also. Goethe said, everything is difficult until you're familiar to do it. I think sinus surgery is the same. You may feel it is very difficult surgery because you are not familiar. How can one become the master fast? Someone said, how can there be such a way? I can say, why not? Much knowledge and skills are needed to become a good implantologist. However, to achieve such a level most efficiently, it is imperative to learn from the talented mentor systematically and practice continuously. I will try to do my best to share the concepts, the knowledges, detailed skills, and my experiences. For swift and speed sinus-borne augmentation surgery, you must acquire necessary knowledge and master basic surgical skills. Please use fine instruments and materials. Pick up a good patient, imitate an expert, and stack up your own experience. Here is a case from a book. Okay? This is a lateral sinus surgery case. What is your impression on this surgery? What you see is what you will do. Okay? So learning from talented mentor is very important. I think This is number 2 sinus bone augmentation course in the world. Then, what is number 1 sinus bone augmentation course in the world? I think it will be my next sinus bone augmentation course. I hope to show you the most fine sinus surgery in the world. You will see. And please check your basic first. This is advanced course. I will also present basic essential implant course. Okay, please listen that topic also. Okay, you've got to be the fundamental down because otherwise the fancy stuff isn't going to work. Okay. If you omit basic, it is not good. It is like a house built on sand. Okay. Weak base is a disaster. Many implant failure comes from lack of basic. Please check your basic first. For implant surgery, we need a basic concept, ability to make a good diagnosis, treatment planning, and prepare adequate instrument. And then you must master basic surgical skills. Next, you can challenge to advanced surgeries such as sinus bone augmentation, ridge split, GBR, soft tissue handling, and block bone. Among this one, sinus bone augmentation surgery is very popular and relatively easier than other surgery. To climb small mountain, we need adequate equipment and physical training. Keep basic for it, please. If you omit basic, it will rise accident. Make goal higher. Okay. Please have a challenge spirit and equip yourself, train, and spend time for training. Okay. Follow your mentor, then you will be stand at top. Soon, after finish my course, you can do such a simple case as your own case. Okay? And if you continue to try, you can challenge to partial or even completely identical case. If you choose my sinus bone augmentation course, you will not be disappointed, I'm sure. Thank you very much.